So I'm an orthopedic surgeon. So that's a surgeon who deals with the musculoskeletal system. So the bones and muscles, joints and tendons. So there are many different, that's a nice thing about orthopedics as well. There are many different facets of it. So I'm a trauma and arthroplasty surgeon. There are people who do spine surgery, pediatric orthopedics, oncology, upper extremity, sports medicine, hand surgery. There are various subspecialties. So you can definitely do replacements in the hands of various joints and wrists. They can do ankle replacements, shoulder replacements, elbow replacements. Do joint replacements in trauma. So I deal with arthritis, so osteoarthritis of the hip and knee, rheumatoid arthritis. I deal with fractures, so broken bones. That's an arthritic hip, and that's what a hip replacement would look like.
Wow, that's incredible.
So there's
I had no idea.
We cut off the ball, and we put a stem down into the femur, and we put a metal socket in the cup with a plastic liner, and that becomes your new hip. So typically I'd be at the hospital by about 7:30, 7:45, and 1 or 2 days a week I might be in the operating room. So I would operate during the daytime, and then at the end of the day I'd go and do rounds and whatever paperwork needed to be done, and then usually get home about 6 o'clock. There are the days where I would be at the outpatient clinic, so I would see follow-up patients who have had fractures or see new patients. Again, arriving at about 7:45, doing clinics, seeing my patients after. Then there are other days when you might be on call. Again, arriving about 7:30. A call for us is a little different. Basically, we're operating all day. The patients have come in the evening before, or the day before, and so we're operating all day and into the evening and into the night. And usually we finish up at about midnight. Let's shut the OR down then. It's very gratifying, actually. I'm very fortunate. Joint replacements, hip and knee replacements improves people's quality of life more than a lot of things we do in medicine. So we have people who come to see you and they can't walk, they can't sleep, they can't work, they're on narcotics, and basically they come and see you. For the most part, they come back and see you in a year, and they're very thankful and look, you gave me my life back. The other person has some problems, but most people are very, very thankful. My dad was a surgeon, and so that kind of sparked my interest. And just growing up, I always enjoyed biology and things like that, and one thing led to another. When I was going through medical school, I kind of continued on wanting to do surgery. I enjoy working with my hands and things like that. Conception that everyone has to be the big burly person to go and do joint replacements or do orthopedics, and it's more technique. It's not a strength thing. For someone interested in doing something that I did, I think the main thing is you have to have a lot of determination. You have to work hard. Don't be discouraged by the hours that people talk about.
What's that?
Because they're seen as long hours, but we all really enjoy what we're doing, and I think that's the prime thing whenever you choose a career. You have to choose something that you enjoy doing. The hours go by very quickly.